I'm Elaine Pereira, author of I Will Never Forget, a daughter's story of her mother's arduous and humorous journey through dementia. In brief, my mother's was a story that needed to be told. She was a kind, brilliant, talented woman all of my life until dementia took hold, leaving an agitated, confused, and bewildered person in its wake. Today's presentation is about dementia versus Alzheimer's. They are often used as interchangeable terms, but in reality they are not. So dementia is a cluster of symptoms, not a disease. And there are many causes of dementia, which we'll talk about shortly, including Alzheimer's, but there are many others also. The symptoms can be memory loss, confusion, personality changes, unfortunately often negative, impaired judgment, which is kind of a broad category, but it includes decreased problem-solving skills. So the person that you know that used to be able to figure out how many cups there are in a quart of milk suddenly can't. Concentration and logical thinking. You find that your friend or someone you know is drawing conclusions that are clearly not substantiated by facts. This cluster is important to look at because there are many causes, not just Alzheimer's. These series of causes of dementia, which we'll talk about now, for the most part, are relatively easy to diagnose and to treat. And what's very important to understand is if you see a behavior or an issue in someone you know that's uncharacteristic for them, is not just assume that they're getting older or that they have Alzheimer's or you can't do anything. It's important to rule these causes out or understand them better. One cause of dementia can be medications. The individual may be taking too much or too little, or there may be an imbalance in medications taken together. These things need to be looked at. These two, urinary tract infection and normal pressure hydrocephalus. UTIs, for some reason, are particularly devastating to older people and often cause dementia symptoms if untreated. Normal pressure hydrocephalus, it's not common, but it does happen, and it's something that can be diagnosed. There's too much fluid on the brain, and it can be drained with a shunt. Head injury and head trauma. If the person that you know is driving, you may not know that they've been involved in an accident. That head injury, if there is one, may be something that they don't remember. That's the dementia piece. As well as trauma, like falling at home. It's not witnessed, you don't know what's going on. Stroke, tumors, and brain infections fall under the neurological disorders, and for the most part, they can be treated, they can be diagnosed. Thyroid and cortisol fall under metabolic and endocrine issues. Again, usually pretty easy to diagnose and treat. Dehydration and alcoholism are also causes of dementia and need to be recognized for what they are. So the point is that all of these various disorders, diseases, conditions, problems, and issues all can present themselves as dementia and not be Alzheimer's. And then there's Alzheimer's. What's important to understand in Alzheimer's is that it is a real, progressive neurological disease. It is not a personality quirk. It is not to be assumed that just because someone's gotten older that they should have memory problems or confusion. That is not necessarily the case. At this time, Alzheimer's does not have known preventions and known treatments. Research is certainly working rapidly in that direction, but for right now, Knowledge is still power, and understanding what's going on with someone that you care about is very important. Whether it is more easily diagnosed and treatable, or whether tragically it's Alzheimer's. Living in the bubble of denial does not help you or them. Thank you.